Well, after a 2-month ceasefire in Gaza ended, the humanitarian situation in the enclave has got worse, according to the aid group Doctors Without Borders. It says Palestinians in Gaza could face food and water shortages again, along with the risk of disease outbreaks due to the lack of basic medical facilities. Sarah Vuylsteke is working for Médecins Sans Frontières as a project coordinator for Northern Gaza. She recently returned from there and joins me now from Belgium. Appreciate you being with us.
Good morning, how are you?
Good. So how would you describe the conditions of many of the medical facilities in Northern Gaza that you visited?
Well, I think it's hard to say because we found when we did our assessment of Northern Gaza that there are actually no medical facilities essentially left. Every single primary healthcare facility that we visited had been flattened, and the 3 hospitals that are in Northern Gaza were either destroyed, like Kamal Adwan, or severely damaged and need significant work to become functional again.
And what services have you been able to provide with the mobile health clinics that Médecins Sans Frontières is operating, and how are those services being impacted by this renewed Israeli bombings? Has it just brought that to an end?
Unfortunately, the resumption of hostilities has meant that we have been forced to end the mobile clinics in Northern Gaza. These clinics were providing primary health care, basically consultations, wound care, care for pregnant women, and we were seeing hundreds of people a day in both Beit Hanun and in Jabalia. And unfortunately, since the fighting has restarted, it has become too unsafe, and we have been forced to end that activity.
And can you talk to us about what impact these renewed Israeli strikes and, of course, the shutting down of aid has had on already bad humanitarian situation across Northern Gaza?
Well, I think the situation across Gaza, not just in Northern Gaza, is disastrous at this point in time. We have seen in the past week over 700 people being killed, over 1,300 injuries. 20% of those are children. People are reporting that they are trapped. There are hundreds of thousands of people being displaced. And one of the main concerns that is currently there is that a lot of people who are sick, who are elderly, who are disabled, are unable to comply with the evacuation orders and need guarantees of safe passage and an enabling manner for them to be able to move. Of course, we are also deeply concerned about the attacks on the healthcare. There was the attack on Nasser. There was a Palestinian Red Crescent ambulance convoy that was targeted a few days ago. All of this means that we are seeing more people with injuries coming back into hospitals as health facilities are being targeted. And at the same time, we are again being overwhelmed with countless injuries of women, of children, of elderly. And we are struggling to not only address that volume, but we are also struggling because medical supplies are running out as the blockade has been in place for the past 3 weeks.
And Sarah,
of course, with that, good.
Sorry, Sarah, your organisation is calling for the immediate restoration of the ceasefire and for the resumption of the entry of essential aid and basic supplies. How likely is it, do you think, that your organisation will see this happen, and how critical is it that it does happen?
It is extremely critical. The shortages across Gaza are getting more pronounced every single day. At this point in time, I have been informed that there is only 1 week left of flour availability. If that runs out, we will see a spike in food insecurity. None of the bakeries will be able to work. We also have to take into account that it's not just food and medical supplies. The water infrastructure was already severely damaged before the ceasefire took place. With the cuts of electricity by Israel and the refusal to allow fuel in, we're also seeing that there's just not enough access to water at this point in time, especially safe drinking water. So it's absolutely critical that this is restored to enable us to provide basic services and for people to survive. Will we see this? I think that is a very good question. We are hopeful that people will allow aid to come in and to adhere to international humanitarian law obligations to allow for aid to come in. And we really do hope that both Israel and allies of Israel will, enable this to happen in the very near future. Otherwise, the consequences will be catastrophic.
Sarah Vuylsteke, thank you so much for talking with us. We appreciate it.
Thank you very much for having me.